This is the Department of Human Services Licensed Child Care Center video module series. Module 1, Defining Licensed Child Care Centers in Minnesota. Slide 2, Welcome.
Welcome. We are so glad that you are interested in learning more about licensed child care centers. This series of e-learnings will give you information about what it means to open a child care center as a business in the state of Minnesota, as well as key areas of child care center licensing requirements.
Slide 3, Types of Child Care.
Healthy and safe child care settings promote child growth and development, stable families, and strong communities. The Department of Human Services Licensing Division has a critical role in monitoring and supporting health and safety in licensed child care programs in Minnesota. Licensure provides the necessary oversight to ensure that child care is provided in a healthy and safe environment, provided by qualified people, and can meet the developmental needs of all children in care. Licensed child care centers are just one type of child care available to children and families in the state of Minnesota. The focus of this module will be on licensed child care centers. However, to aid in your understanding of child care options in Minnesota, here is some information on the other types of child care in Minnesota. Licensed family child care is care of children that typically takes place within a provider's own home. Licensed family child care programs are typically operated by one individual who is licensed to care for up to 12 children. Family child care programs are licensed by the county or agency in which the program is located. In Minnesota, there are situations in which child care meets an exclusion from licensure. The exclusions from licensure exist for unique circumstances. For situations where child care is provided in a center-like setting and licensure is not required, it is generally because those programs are approved, regulated, or accredited by another unit of government or another organization with federal, local, or national board oversight. Child care centers that are excluded from licensure but wish to receive Child Care Assistance Program (CCAP) funds can apply to become certified. These programs are certified license-exempt child care centers and are required to meet minimum standards for health and safety set forth by both federal and state law. As with licensed child care centers, they are monitored by the Department of Human Services. Family child care providers caring for one unrelated family meet an exclusion from licensure. If a provider caring for one unrelated family wants to receive Child Care Assistance (CCAP) funds, the provider can apply to become a legal non-licensed child care provider. If you would like to learn more about these other types of programs, you may reach out to your county licensing team or the Department of Human Services.
Slide 4, What is a licensed child care center?
A child care center is a business owned by an individual, corporation, or an organization that is operated in a facility where care is provided for children. The children who attend can range in age from 6 weeks old to 12 years. In a child care center, children are generally grouped with other children of similar ages, for example infants, toddlers, preschoolers, and school-age children. Providers can build their own unique businesses while following licensing requirements that provide for the health and safety of the children in their care. Licensed child care center owners must obtain a license and maintain compliance with statutes and rules. When the Department of Human Services determines that the applicant has complied with all applicable rules and laws, a license will be issued to operate within the parameters of the information entered on the application, including the times, days, and months when the center is licensed, and the maximum number and ages of children that may receive care. More information on definitions of a child care center can be found on the Office of the Revisor of Statute webpage under Minnesota Rules, Part 9503.0005, Subpart 7 Minnesota Statutes, Section 245A.02, Subdivision 10.
Slide 5, Licensed Capacity and Age Ranges.
Licenses for child care centers specify a capacity. Capacity refers to the maximum number of infants, toddlers, preschoolers, and school-aged children a center can provide care for at any one time. Definitions of age categories can be found in Minnesota Rule, Part 9503.0005, Subpart 2 in Minnesota Statutes, Section 245A.02, Subdivision 16. A child care center's capacity is requested by the center owners and determined by multiple factors, including city zoning requirements, fire and building code requirements, the size of the physical space used to provide child care in the facility, and the ability to meet other licensing requirements. The capacity is determined by licensing, based upon examination of information provided and verified during a licensing visit to the facility.
Slide 6, Schedule of Operation.
The schedule of operation for a licensed child care center refers the months of the year the center will be open and the days of the week and hours of the day the center will be open to care for children. Children can only be cared for during the months, days, and hours that have been approved on the Child Care Center license issued by the Department of Human Services.
Slide 7, Non-Residential Facility.
Minnesota licensed child care centers are located in a facility that is either owned or leased by the license holder, zoned for non-residential purposes. This includes the indoor and outdoor space where services are provided for children. Child care center licensing laws in Minnesota have specific requirements related to the indoor facility and outdoor space where child care will be provided. For that reason, particular attention should be focused on ensuring that the physical location and facility meets the requirements in Minnesota Rules, Part 9503.0155, or that the facility can be renovated to meet them. It is highly encouraged that applicants consider all of the child care center licensing requirements, any enhancements to the facility to make the space suitable for group child care, usable square footage, the outdoor activity area, and the operation plan when choosing a facility and location.
Slide 8, Licensing Requirements in Minnesota.
Licensed child care centers in Minnesota are required to maintain compliance with applicable rules and statutes in law. Licensure provides the necessary oversight to ensure child care is provided in a healthy and safe environment, provided by qualified people, and can meet the developmental needs of all children in care. Child care center licensing requirements can be found in Minnesota Statute and Rule. Office of the Revisor of Statutes offers a searchable website where the public can search and read statute, laws, and rules. The website address is https://www.revisor.mn.gov.
Slide 9, Department of Human Services.
The Licensing Division is part of the Office of the Inspector General, which is part of the Department of Human Services, commonly referred to as DHS. The Licensing Division has a responsibility for regulating licensed and certified programs in Minnesota. The Licensing Division regulates programs through the application process, monitoring visits, and investigations. The licensing division also oversees any changes made to the terms of the license and any variances that may have been granted for certain requirements. The licensing division partners with providers with a goal to ensure that information and resources are available so that providers can be compliant with licensing requirements. Information and resources can be accessed through our websites, forums, trainings, and email communications. Ultimately, licensing requirements and the licensing division are in place to ensure the children receiving services at child care centers in Minnesota are safe and healthy.
Slide 10, DHS Child Care Center contact and web pages.
For application or licensing requirement questions, a licensor on call is available Monday through Friday from 8 a.m. to 4:30 p.m. by calling 651-431-6500 and selecting option 3 or by emailing at dhs.ccc.licensing@state.mn.us. The DHS Licensing Division also has several web pages available to help with questions regarding licensed child care centers. General information for all licensed programs within Minnesota can be found on the Minnesota Department of Human Services Licensed Programs Information web page. This web page includes information on ownership changes, background studies, legislative changes, reporting maltreatment, frequently asked questions, as well as a link to the web page for child care and early education. The specific licensed child care center information web page is home to news and updates, how to contact licensing, and other information such as health and safety requirements, forms and documents for licensed centers, and staff training. Additionally, there is a link to the web page for applying for child care center license that includes specific information on the process of applying for a child care center license.
Slide 11, questions and help.
In addition, a resource called Child Care Wayfinder is available as a one-stop navigation network for starting and growing childcare in Minnesota. Navigators are located throughout the state and offer personalized support and resources to help you succeed. More information can be found on the Child Care Aware Minnesota webpage.
Slide 12, Child Care Center licensure application process.
Getting your child care center licensed in Minnesota is a process involving several steps. The Child Care Center license application process is described in phases. In Phase 1 of the application process, you will submit an application for a child care center license, which includes submitting information about your program and documentation such as ownership verification, proof of workers' compensation insurance, policies and procedures for staff and parents, and a facility floor plan. In Phase 2 of the application process, you will be assigned a DHS licensor who will work with you throughout the rest of the application process. This phase has many working parts that both licensors and applicants can be working on simultaneously, and progression is not necessarily linear. There are many factors that affect how this phase progresses, some of which involve interaction with other agencies for required facility inspections, background studies, and engaging a health consultant. Additional submissions during this phase include documentation of administrative, personnel, and children's records requirements and equipment and supply requirements. During Phase 3, the program is preparing for and scheduling the pre-licensure inspection, which is conducted by your assigned licensor. This pre-licensure inspection needs to occur and documentation of compliance confirmed prior to DHS granting you a license for your child care center.
Slide 13, thank you.
The content in this video module is current as of the date presented. The licensing division reserves the right to update or revise as applicable. Thank you for watching.